Hello, my name is Dr. Fabiola Gill, and I'm a gynecologist at Women's Health Service in Arlington, Texas. My patient age range from 18 to 49 years of age. My role as a gynecologist is to examine and treat diseases and certain conditions from the reproductive organs and area of the female patient. The issue that I will be speaking of today is called toxic shock syndrome, or so-called TSS. This is a bacterial infection. Usually the most common is called Staphylococcus. This usually occurs when a woman is menstruating and is using tampons that are non-cotton. I usually see this 2 out of 100 patients that I receive throughout the days at the clinic. This infection gives out several symptoms like having a high fever, chills, diarrhea, nausea, vomiting, rashes, which those are just some of the most common symptoms. What I usually prescribe to patients, this is an antibiotic such as vancomycin and or a penicillin antibiotic such as nafcillin. This is usually done for 6 to 7 weeks. If nothing has changed and the patient comes back for the same issue, then it has done damage to other organs and other procedures are taken. One of the patients that I will be talking about is a 20-year-old Caucasian female whose socioeconomic status is in the lower middle class. She previously explained her pain for skin rashes, having high fever, and vomiting. She further explained that there were times where she would leave in her tampon for a longer period than the usual 4 to 6 hours. This caused bacteria to enter the vagina region. After a few examinations, she was diagnosed with toxic shock syndrome. Although she was experiencing rashes and high fever, her other organs did not become damaged. I then prescribed her penicillin antibiotics for 6 to 7 weeks to kill the bacteria and prevent the spread. My recommendations to prevent TSS bacterial infection is that if you get a cut or wound, try to keep it clean and dry. This can also occur through cuts and wounds. In females, if tampons are used, make sure that they're the least absorbent and that they are cotton-based. Also, changing them constantly can reduce the risk of bacteria from entering the vagina. Major problems occur when the TSS is not treated immediately. It can lead to bigger problems and eventually lead to death if the bacteria enters the bloodstream.